cerebral palsy is a movement/posture disorder, and it occurs as a result of a non-progressive, i.e. one-time disturbance to the brain, either prenatally or perinatally. So the possible comorbidities that can occur with cerebral palsy are pain, learning difficulties, seizures, and visual impairment. So the biggest risk factor for cerebral palsy is prematurity. And this actually puts you at a higher risk of periventricular or periventricular leukomalacia, and also an increased risk of intraventricular hemorrhage and other things such as bronchopulmonary dysplasia leading to cerebral palsy. About 10% may be potentially due to a hypoxic ischemic injury at birth. So some postnatal causes of cerebral palsy include meningitis, encephalitis. What else? Trauma, hypoglycemia, hydrocephalus, hyperbilirubinemia, which is actually a preventable cause. So it did not need to lead to cerebral palsy if it was caught early enough. So in terms of presentation, you have a delay in your motor milestones. And also you'll have posture abnormalities. And these posture abnormalities will tend to be asymmetrical. You may have feeding difficulties as well. And so a diagnosis of cerebral palsy is a clinical diagnosis, so a thorough history is needed. But MRI scans may assist in identifying the cause, but are not actually necessary for diagnosis. Okay, so there are three main types of cerebral palsy. The first being spastic cerebral palsy, and that makes up about 85% of cerebral palsy disorders. And it occurs due to an upper motor neuron lesion, either pyramidal or corticospinal. So you get an increase in tone, you get brisk tendon reflexes, and extensor plantars. So spasticity actually tends to present quite early in the neonatal period. So there are kind of three main types of spastic cerebral palsy. So you've got hemiplegia, which essentially which is most common type, and it essentially it affects unilaterally. It affects a child, such baby, unilaterally, whereby the face is often spared, and essentially you get tiptoe walking on the affected side. And then you have diplegia, whereby all four limbs are affected, but the legs are actually affected more than the arms. So sometimes it might seem that the arms are quite normal, but because the legs are so affected, so you'll find that they're walking quite abnormally. And then you have quadriplegia, where all four limbs are affected, and there's also trunk involvement. So you're going to have poor head control as well, and low central tone. So in terms of, so we have another type of cerebral palsy, that's dyskinetic cerebral palsy. And this occurs as a result of damage to the basal ganglia or associated pathways, extrapyramidal, by the way. So they present with floppiness, poor trunk control, delayed motor milestones, involuntary / uncontrolled movement. So yeah, and muscle tone can be variable. So different movements that they can have is like chorea, Athestosis, which is basically slow writhing distally, either finger fanning, like that, such as finger fanning, or they can have dystonia, so sustained repetitive muscle contractions, which can lead to, abnormal twisting slash repetitive movements or abnormal fixed postures. But intellect may be relatively unimpaired. And then you have ataxic or hypotonic cerebral palsy, which is mostly genetically determined, and you have early trunk and limb hypotonia, poor balance, delayed motor development, and incoordinated movements, and an ataxic gait later on may present. Okay, so management, as I discussed briefly before, is MDT, multidisciplinary approach. So you can get various teams involved, such as the physios, speech therapists, occupational therapists. You want to also be able to manage their pain, and you want to improve their spasticity, e.g. with baclofen or diazepam. And you might want surgery to restore restricted muscle tone or relocate hip joint or correct scoliosis, which can occur in some patients.